Good evening to all the viewers who are watching live and also watching in recorded version. So there is a little bit of announcement to make that if you are seeing this and we are soon going to updates the soon going to post highlights of all the CMEs. We are trying to post the highlights of all the CMEs we are trying to get, but due to some issues with our server and some other personal issues, we are delaying some of this our upload. So do subscribe to get the updates first. So before starting, make sure to subscribe. Okay. So without wasting any more time, let's just start with our 30 seconds countdown time of 40-second CME.
Good evening, sir, and good
Good
evening to
evening.
all of the
Very
viewers.
good evening.
On a very happy note, we are going to start our 42nd CME. The day we started on the lockdown phase, the first CME, and slowly we had covered Silver Jubilee, now first crawling and almost strolling towards the Golden Jubilee CME. Now, on this 42nd CME, with the permission of our President Kalyani sir, let me introduce our inaugurator tonight. Sir, with your permission,
Sure.
thank you, sir. And our inaugurator tonight is our beloved Dr. Debabrata Mahapatra, who is our alumni of 23rd batch of National Institute of Homoeopathy. Now, this is the place where so many people are getting united. We have with us our president, Dr. Narayan Kalyani, who happens to be third batch of DPNH, way back. The first batch of DPNH started in 1975. Sir is from third batch of DPNH, and myself from first batch of BHMS. And our inaugurator tonight is 23rd batch of BHMS. So, without further delay, and as Sir had permitted, I'll request our backstage editor, Medico Orko Mukherjee, to bring on screen our inaugurator tonight. Over to you, Dr. Debabrata.
Over to you, Dr. Debabrata.
Good evening, everyone. Myself, Dr. Debabrata Mahapatra from 23rd batch. I welcome all of you to webinar by National Institute of Homeopathy Alumni Association. It is my privilege and I am very much honored to inaugurate 42nd CME virtual platform. This platform, yes, from this platform, we can learn some knowledge which affect our daily practice, and I believe the CME webinar will not give us only knowledge to our alumni, it also unite all of us. Today we are having two eminent speakers, Dr. Birodh Kumar Mahato, 19th batch UG, Vice President All Nepal Homeopathic Association. He will talk about levels of health, and another eminent speaker, Dr. Ritam Maity, 7th batch UG, Medical Officer, Acupuncture, Government of West Bengal. He will talk about homeopathy and acupuncture. I would also like to thank our President, Dr. Bidyut Mukherjee sir, and Secretary, Dr. D.N. Kolkata sir, for giving me the chance to be a inaugurator. Prize winner, two students, Sandeep Chakraborty and Meriko Swab Agarwal. Ahmed. Both are from Minnapur Homeopathic Medical College and Hospital. And I would also like to handed the mic to Dr. Partha Pratim Roy sir as a moderator of today's session, and he was a third batch UG MD MSc Applied Psychology, member Board of Studies, Maharashtra University of Health Sciences, Nashik, and hand mic to Sir Dr. Partha Pratim Roy, and thank you, sir.
Over to you, sir.
Myself?
Yes, sir. Yes, sir. Over to you, sir. Now you will just start the CME with the other process. Over to you, sir.
Myself, Dr. Roy? Or should I speak?
Yes, sir. Yes, sir.
I think this will be a very pleasurable moment. So the Alumni Association had given me chance to moderate that 42nd online platform of continuous medical education, that is CME. So today we have got two speakers as Dr. Mahapatra had already introduced. So without delaying further, so I would like to call upon Dr. Ritam Maity, who is a medical officer, acupuncture, government of West Bengal, to deliver his lecture and deliberation on acupuncture and homeopathy. And later we will listen, and I am eager to listen, Dr. Birodh Mahato about the levels of health. And then when the session will be over, then I would like to commemorate, and I would like to make a synopsis of all what they have said. So thank you once again. Back to our Orko. I think it is the high time to call Ritam here to speak.
I welcome all viewers and listeners. Hello, am I audible and visible, please?
Yes, sir. You are audible and visible, sir.
Hello. May I start?
Yes, sir. Yes, sir. Yes, sir.
Well, welcome all viewers and listeners today in this session of CME. And first of all, I want to thank Dr. Bidyut Mukherjee and Dr. Chandrasekhar Pore to giving me an opportunity to share my experiences over this platform, and my humble gratitude to Dr. Kalyani sir and other senior teachers, and my good wishes to my friends and good wishes to my juniors too. And let's start our program. My topic is homeopathy and acupuncture. Of course, there are two intercorrelations of the two pathies and their scopes, their limitations. All these things will be discussed. May I? Can you help me, Orko? Please, whether my slides are visible or not.
No, sir. The slides are not visible.
Whether my slides are visible or not.
Sir, the slides are not visible, sir.
Actually, there are so many photos of patients and investigations like X-ray and other features. So it will be very difficult to explain those things. Other than I
No,
can
sir.
speak up. What should I do?
Sir, then you have to try again with the process.
Well, let's start. Gradually, I am progressing, and Dr. Bidyut Mukherjee will help me accordingly.
Okay, sir.
This is actually homeopathic medicine. This is the tool of homeopathic use, and this is actually acupuncture needle. This is main thing for the acupuncture. And at first, I want to demonstrate the acupuncture method, because we all know the homeopathy. We are all homeopathic registered practitioners. So there is no need to tell anything about taking of homeopathic medicine, but I can demonstrate this to you. Firstly, how acupuncture actually done. This is the needle and cotton spirit is there. I want to prick here on myself. Is it visible or not? I could not understand, but still I am doing this. I am putting the needle on the acupuncture point. I have pricked it and inserted the needle. Can you see? This is acupuncture. This is the needle and this is acupuncture. Let's start. In homeopathy, we know all that 7 cardinal principles are followed, and in homeopathy there are so many principles based on principles and natural laws, and the principles are mainly law of similia, law of simplex, law of minimum, theory of chronic disease, we all know, doctrine of drug dynamization, that is potentization, doctrine of drug proving, obviously on the healthy human being. And after all, very important thing is vital force, theory of vital force. It is important for this session. Actually, acupuncture is based on those theories too. That's why I'm emphasizing the vital force. Homeopathy trials, actually drug provings are done on the healthy human being, and acupuncture is also done on the healthy human being firstly, then on the others. And through the homeopathy, we want to establish the well-being of physical, mental, social, and of course physical state. That means we want to maintain the health by individualizing the patient. We select the homeopathic remedy. After taking of the cases, full case taking was done, and then individualization is done with the holistic approach. But still, it is a complementary and alternative medicine. Homeopathy around the world is still now is complementary and alternative medicine. It is not indigenous, it is of German origin. And the concept of integrated medicine is a very popular topic today in the international seminars. I have attended few. That all the systems have scopes and limitations. Those are collectively discussed there. And around the world, WHO published a report on 2012 that only 24% of the world population is taking allopathic medicine. It means a majority of the population is not taking the allopathic medicine. Then what they are doing? They are accepting the traditional system of medicine. Around the world, in different countries, there are so many traditional system of medicine. In medical science, if we divide medical science into 2 parts, that is surgical part and another is the medical part. And in the medical part, there are so many traditional system of medicine. And WHO 2000 published a report on 2019 to emphasize on the traditional system of medicine around the world to promote that traditional system of medicine. And affinity towards holistic approach is much more increased after that. And what is vital force? We know it is described in the aphorism 9 to 17, that essential energy, that essential for the life, vital principle, life principle, we all know that. Still, I am mentioning today. Maintains harmony of functions, differentiation of living and death is done by the vital existence of the vital force, and it is everywhere in the body. And in acupuncture, you can see it is actually a part of traditional system of medicine of China, which is called traditional Chinese medicine. Acupuncture is a healing art without use of any drug. There is no use, it is a drugless therapy, and it is a part of TCM, means traditional Chinese medicine. And nowadays, now more than 150 countries are practicing acupuncture, and WHO have given the permission to treat 43 diseases through acupuncture therapy. It is also not indigenous, it is of Chinese origin, and development also done there. Also based on acupuncture is also based on principles, theories, and natural sources. Of course, individualization is also there. And still, both acupuncture and homeopathy is complementary and alternative medicine. Acupuncture is an English word. Acus, a Latin word, means needle, and puncture, a Latin word, means to puncture. It means puncture often through a needle is called acupuncture. In China, it is called chain. Though the spelling is Zhen, but pronunciation is chain. And development of acupuncture was done in China in Neolithic age. It means at least 10,000 years ago, the acupuncture was then discovered through a nice history was there. At that time, the stones were used for the acupuncture, and the stone were called Payan needle, Pian, Payan needle. And in ancient China, the legend actually told that when fighters injured through sharp weapons like arrows or got injured in any other ways, they got relieved from chronic illnesses. Like leg injury relieves the chronic discomfort, abdominal discomfort, and chronic headache too. Means injury at the leg with a serpent weapon relieves the chronic ailment of abdomen and headache. This is actually observed. And where the pricking sites, those serpent things, pricking sites are called acupuncture point. Acupuncture point. And after puncturing the needle, a sensation is produced. A tingling sensation, a heaviness, a burning, a numbness sensation is produced. That is called techi. And that sensation goes through the proximal and distal ends of the body. If I draw an imaginary line, that line will be called meridian or channel. And in our body, those channels are interrelated. Hello? And those channels are interrelated to each other through luo or collateral channels. 12 main channels are there in our body, and another 2 extra channels are there, that is in the ventral aspect of the midline and the posterior midline, and other extra channels, 8 extra channels are there. It means 361 in the one side of the body. 361 acupuncture points are used nowadays. That means 722 points are present in all over the body. And when we studied this acupuncture course after completion of the homeopathic course, the name of the course was Acupuncture and Moxibustion. What is Moxibustion? Actually, Moxibustion is excuse me, I want to show the slides today. That's why. Yeah. Can you see my slides now? Hello.
Yes, sir. It's visible.
Is it visible? Well, thank you. This is a picture of Moxibustion. Moxibustion, actually, the process is to apply the focal heat on the acupuncture point to the moxa stick. Moxa stick, this is the moxa stick. Moxa stick is prepared from the dried leaf of Artemisia vulgaris. And you will be surprised to know that the burning heads of that moxa stick is much more heater than the burning head of cigarette. If moxa stick produces 1100 degrees centigrade at a time, but the heat is applied from a distance very cautiously. And let's tell about the traditional Chinese medicine theories, because I have told that homeopathy is based on few theories and principles, and same as acupuncture too. In the Shang Dynasty, means 300 years ago, traditional Chinese medicine was compiled, and those time theories are yin and yang philosophy. Yin and yang philosophy. 5 elements theory means Panchabhuta Tattva, which is present in our country also. After that, Qi. Qi means the vital energy. Chi means actually the vital energy. It is actually similar to the concept of vital force, and other things are there. And if you see the picture of yin yang symbol of the yin yang, you can understand the philosophy, because philosophically all these things are described very easily. Yin and yang are actually telling that nothing is absolute in this world, and every character has its opposite character. Everything has its opposite existence. It means yin means sorrow, and yang means happiness. Likewise, female, male, interior, exterior, tissue, function, ventral, dorsal, everything has its opposite character. But there are some mutual relationships too. In the symbol, you can see the white portion consists a black portion, and the black portion is also consisting of a white portion. It means, and they are actually interconnected. It means day, in between day and night, there are dawn and dusk, and in the mutuality depending others and infinite intertransmission is also there. There are so many characters which are intertransmission is followed. In case of diseases, why it is very much important? Because if there is any disease process, there must be a non-disease process, and we have to work out with that opposite non-disease process. And in the family also it is carried out. In a couple, if there is love, it means there is non-love element too, but we have to exclude the non-love element. This is yin yang theory, and there are other theories too. This is Changfu organ. Changfu organ actually is this is Changfu organ. Changfu organ is not actually the anatomical organs in our body. 5 hollow organs like bladder and etc., large intestine, and 5 solid organs like liver, heart. These are actually not anatomical organs, but there are some theories. I am not going to discuss this Changfu organ theory. There are Changfu organ clocks are there. Aggravation time denotes the affected organ according to the Changfu organ theory. And then comes to Qi. What is Qi? Qi actually is vital force. Qi actually is vital force, the fundamental substance to constitute the universe and all phenomena. Due to change and movement of Qi, vital essence of body which flows through channels and collaterals. It means it is just vital force. Functional activities of organ and tissues are dependent on the Qi. And by the use of acupuncture needles, we correct the Qi. Now, acupuncture in India have come to India with the blessings of Dr. Vijay Kumar Basu in the year 1959, when Mr. Hello, am I audible? Hello, am I audible?
Sir. Yes, sir.
Well, hi, Dr. Vijay Kumar Basu was a member of the Indian National Congress Medical Mission of the Second World War 1938 to 43, when Jawaharlal Nehru and Subhash Chandra Bosu sent 6 members to the China to help the injured people of China when Japan attacked China. And the members were Dr. Madanlal Atal, Dr. M. Ramchandra Kolekar, Dr. Vijay Kumar Basu, Dr. Dwarkanath Kotnis, and Dr. Devesh Mukherjee. And in acupuncture, there are different techniques. This is a picture of Dr. Vijay Kumar Basu. And there are different sizes of needles are there. And the cupping is also done. This is a cupping cup. This is a cup. I can show it later on. Cupping is also done, and needle embedding methods are also there. Needles are embedded into the body where it is needed, and it is kept for 24 to 48 hours too. And ear acupuncture is also very popular, auricular acupuncture, and scalp acupuncture is also very popular. And according to the homeopathy, we select a medicine after thoroughly taking up the case and after repatriation and the characteristic symptoms finding and the individualization was done. Likewise, in acupuncture too, before applying the needle, we have to select where to prick the needle. It is like local points. We have to select adjacent points according to the complaint of the patient, and distal points, specific points, and points according to innervation, means dermatome wise. And there are so many misconceptions regarding acupuncture is carried out in our society. I don't know why it is thought of that acupuncture is the last treatment. Once it fails, no other treatment will work. It is actually not like that, because patient comes to acupuncture clinic after spending enough time in allopathic system or any other system. And there also in acupuncture therapy clinic, they don't spend enough period to treat some disease. They actually switch off to another therapy. Those types of patients are claiming that it is the last treatment. Once it is tried, no other system will work. This is not like. And it is also a misconception that acupuncture ruins the nerve. Actually, it is not possible, because acupuncture points are mostly nerve endings, nerve receptors are there. We want to reach nearer to the nerve receptor, and we are not going to harm any nerve, but to stimulate the nerves for the betterment of the health. And blood is drawn out from the body through needles. It is also a misconception. It is not possible, because this needle is a filiform needle. It is a solid needle. It is not like an injection needle. And the where in use of electroacupuncture, where it is used, the wire does not contain any channel to draw the blood. So it is also a misconception. There may be tetanus or AIDS. It is also claimed by some allopathic doctors that tetanus or AIDS may be happened by this acupuncture therapy. But for our betterment, single case of these diseases were not noted around the world, because the sets of the needles are personal. Every patient has their own needle set, and acupuncture makes body weak. This is a very important point. Acupuncture actually stronger the resistance, makes stronger the resistance power of the body, not the weak. Acupuncture enhances the immunity, enhances the resistance power. It is a new therapy. It is also claimed that it is a new therapy in our country. Not like that. It is actually a therapy of 10,000 years ago. It is discovered. And you can see the another type of acupuncture needle. This is hammer. This is hammer. It is shown in the picture too. This is hammer. And now I am going to discuss the effect of acupuncture in the light of modern medicine. It is very important that it is a drugless therapy. It relieves joint pain, respiratory troubles, sinusitis, and migraine instantly, and it is proved. And we know that cardinal parameters of scientific judgment is that experiment, observation, and inference. If I say that hydrogen atom and oxygen atom in the laboratory, if it fuses through any means, it will produce water, the H2O. It means we are experimenting with the fusion, observing the production of water, and getting inference that hydrogen and oxygen can make the water molecule. Likewise, a patient is coming with a trouble. I am putting the needle in front of all the others, and the patient is getting relief. It is also observed by experimentation, and maybe the conclusion that the patient is cured of the pain or that suffering which is treatable with acupuncture I am not going to I am not going to beyond the limitation of acupuncture. And analgesic effect, it is described very well that acupuncture has an analgesic analgesic action is described by two theories mainly. One is actually pain is carried out to the spinothalamic tract, and spinothalamic tract carries mainly three types of fibers: A delta fiber, beta fibers, and C gamma fibers. A delta fiber is actually a thick fiber which carries the mild pain that produced by acupuncture needles, and the moderate and very heavy severe pain of the body original pain that is carried out by the C gamma fibers, that is very thin fiber. And we all know that action potential runs through saltatory movement in the thick fiber, means A delta fiber, in the very fast way. That's why through the spinothalamic tract, the mild pain produced by the acupuncture needle, it reaches to the thalamus where pain sensation is received in very faster way than the original pain. And here is the gate control theory of pain, and that was described by two scientists, Molazek and Wall, in 1965. So another explanation is that thalamus has a major interaction of pain sensation and acupuncture sensation in that. In the experimental animals, it has been demonstrated that acupuncture sensation reaches ventromedial nucleus, and original pain sensation, that is stronger pain sensation, reaches ventrolateral nucleus of thalamus. These two nuclei lie very close. Here, interaction of electrical impulses of acupuncture sensation and pain sensation, original pain sensation of the body, occurs to greater extent. From thalamus, sensation goes to the sensory cortex. Due to interaction of acupuncture pain and the body's original pain, thalamic nuclei, in the thalamic nuclei, sensory impulses got modulated. And that modulated means changed form of sensation reaches to the cortex. So the sensory cortex cannot perceive pain fully. As a result, analgesic effect is produced. And analogically, if I say this can be explained by, you cannot realize the quarrel of a couple when the TV sound is much more louder in the home. This is the analgesic effect we can get through by acupuncture, and it has a sedative action too, because acupuncture increases the secretion of gamma aminobutyric acid, that is a neurotransmitter in CNS, and it is probably responsible for the sedative action. When I was student, my teacher challenged me that he will make me asleep inside the class when I am listening very sincerely. And surprisingly, it was done done twice in a class. When my teacher put a needle on my leg, after 10 to 12 minutes, I got asleep. So sedative action is also achieved by the acupuncture, and the regulatory effect is also there. When shock is there, body is not responding well. Through the acupuncture, we can maintain the body temperature, pulse, and heart rate, all these things very easily, and it is experimented and accepted all over. It raises the body resistance and enhancing blood supply, and anti-inflammatory effect is also there. Nerve endocrine immune network is very much activated through acupuncture. Acupuncture actually acts through body's own mechanism. And how this thing is done, actually nervous system, immune system, and endocrine system, these are interrelated and they have common messengers and common receptors. That's why if one is stimulated, the neurotransmitter are released, and the other chain stimulation is going on. Actually, cytokine messenger, cytokine means interleukin and lymphokines, monokines, those things are the common key to the endocrine system, immune system, and nervous system. That's why if I stimulate through the needle, the body's own mechanism enhanced, and the humoral secretion like endogenous morphine, enkephalins, this secretion will be very much increased in the body, and it experimentally done, it is on the animals, and it is found and established. So integration with other therapies is possible. Yes, it is possible, and I have done that, and I want to show some slides too. Integration with the homeopathic and Ayurvedic medicines may be applied simultaneously with acupuncture. As yoga therapy stimulates body's own resistance power to combat with these diseases, thus acupuncture is suitable for combined therapy too. Both homeopathy and acupuncture may be used for the prevention of the disease, prevention of hypertension, ischemic heart disease, and diabetic mellitus, and like other diseases. But there are some contraindications in acupuncture too, like limitations of homeopathy. Contraindications of acupuncture are very much cautiously followed. That is bleeding disorders, thrombocytopenia, skin infection at acupuncture site, vascular heart disease, and electroacupuncture. Electroacupuncture means we are going to stimulate the body through acupuncture needle, but in the clinics and in around the world nowadays practicing electroacupuncture, putting the anode and cathode on the needles and applying the TENS, means transcutaneous electrical stimulation, 6-volt current, 12 ampere current is applied in different modes. That is called electroacupuncture, and that electroacupuncture has contraindications. That patient with a pacemaker cannot be put on electroacupuncture, and epilepsy, pregnancy, trigeminal neuralgia will be triggered by the electroacupuncture. I have faced that in the earlier practicing stages of my clinics. When I practiced this electroacupuncture, I put a current on the patient on trigeminal neuralgia, and suddenly triggered pain was started, and it was very much a bad experience. And some congenital spastic conditions are there where acupuncture cannot be tried. Likewise, limitations of homeopathy should be in our mind too. A surgical problem which has progressed far beyond the initial stage, it should not be kept in homeopathic practice. It should be referred. Sudden life-threatening situations like heart attack, paralytic strokes, or diabetic coma, these are the limitations of homeopathy I have noted in my practice. Relatively slow acting compared to the steroids, it is well accepted. You have to accept that homeopathic medicine is relatively slow acting, and 100% success cannot be achieved through homeopathy. This is a flow chart. In the slide you can see is a flow chart. What actually happened after pricking a needle. I don't want to describe this in details. I can show a picture of channel. This is a channel picture. It is called large intestine channel. Though the name is large intestine, but you can see it is actually started from the lateral end of the index finger, outer lateral aspect of the index finger, that goes around the arm and forearm, then goes on. But the name is large intestine channel. Likewise, other 11 main channels are there. Now I am showing you few pictures of my patients in the hospital I faced. This is a case of osteoarthritis knee joint. You can see in the slide. I have tried homeopathy, but I was not getting the satisfactory result only with the homeopathy. When after application of the acupuncture therapy, the patient got relief from the pain, from the swelling, and from the limitations of the movement of the knee joint. And it was possible with the use of two therapies conjointly. This is a case of osteoarthritis knee joint where knee replacement surgery was advised, and I took the risk and I put acupuncture on this. But surprisingly, acupuncture was not working properly. But after putting some homeopathic medicines along with the acupuncture, I got the marvelous results. Till now, patient is walking without any aid and patient is staying at home without any medicine. There was no surgery done. And this is also a case of osteoarthritis knee joint, another patient. He was also advised for the knee replacement therapy, but it is not done today till now. Only acupuncture and homeopathy is relieving him. And another slide, you can see it is thromboangiitis obliterans, means Barja's disease. The amputation of 2 digits was advised and admitted in our male surgical ward. And I went there and I have applied the acupuncture therapy, and amputation was not done, and the pain was relieved from without any painkiller. The patient was there in the male surgical ward, and at least 100 cases were recorded in the SSKM hospital of the Kolkata, that those patients were admitted for the amputation of the leg below knee or below ankle for this Barja's disease, and they were helped by the acupuncture therapy, and amputation was not done, and those records are still kept with the acupuncture clinic of Somunath Pandit Hospital, Kolkata, West Bengal. And this is another slide of ankylosing spondylosis. The slides are coming very slowly. Delay is there. It is coming. This is a case of ankylosing spondylosis where patient was taking the homeopathic treatment alongside Ayurveda treatment too, and somebody told him that you can try acupuncture. The patient came to me and I treated him, and along with the treatment of Ayurveda, homeopathic medicine and acupuncture, patient got relieved, and now he is taking only acupuncture therapy without any medicine. And another slide, you can see I am treating osteoarthritis knee joint. Acupuncture is doing. He is a retired school teacher. Likewise, I can show you few other pictures too. This is the picture of osteoarthritis knee joint. It is coming a little bit delay is there in the coming of slides. This is electroacupuncture and plain acupuncture. When needle is only applied, this is acupuncture, and electrical current, DC current is applied, that is electroacupuncture. Those patients, these patients were treated with acupuncture and homeopathically simultaneously, then only they got the good result. This is a case of frozen shoulder I am showing you. Frozen shoulder, right frozen shoulder. I have applied acupuncture first. When I did not get any result, I put homeopathic medicine, the same condition. And another slide where acupuncture was tried for the sinusitis is also there. Sinusitis and frozen shoulder simultaneously was there. And jaw pain, the picture will show the jaw pain of a patient. He was treated with acupuncture without any current. He is now better. But after taking the homeopathic medicine, patient is not coming to me now. And this is a case of osteoarthritis knee joint where knee cannot be extended fully. But after applying the acupuncture, the pain and swelling is gone, and the limitation of the movement is very corrected. Tennis elbow of a patient was cured through acupuncture when she failed to get relief from the homeopathic treatment. The homeopathic specialty clinic prescribed her to ruta graveolens 30 for huge doses, but didn't got relief anything. And after putting this acupuncture needle and current, she got marvelous result. Now she is working. This is a case of 4th grade Bell's palsy where steroids were tried, and after that ENT surgeon referred to us, and now he is completely cured. He is a merchant of Maity of Kolkata in West Bengal. And this is a case of sinusitis where acupuncture is going on till date. She is taking acupuncture now, and she is much better than the homeopathic treatment and allopathic treatment. And this is, and the next slide will show you the medial plica syndrome of a 12-year-old child, where he failed to get relief from allopathic treatment, but after putting 5 to 6 sittings to the acupuncture clinic he attended, he got completely cured. Now he is okay. And this is a case of kyphosis where due to this deformity, patient felt very painful condition, and after putting the acupuncture, that correction of the spine was not done, but without pain, the pain threshold is changed. That's why he can move very freely. And what I told earlier, that jaw pain and pericapsulitis was cured through acupuncture like this, and I didn't put any electrical stimulation over there. And this is the most common problem we face in acupuncture clinics, that is low back pain and upper back pain too. Back pains are very common in acupuncture clinic. Actually, they come from other departments. They are referred from the other departments. And here, after putting acupuncture, this is a picture of cupping. Electroacupuncture and cupping conjointly tried, and great relief were achieved after this. And if I say that the concept of integrated medicine, there are so many traditional systems, there are so many limitations in our medicine systems, and of course there are so many scopes to be performed. So if we collectively say that if we collect the scopes of the different therapies and discuss among us, it will help us to give relief to the suffering element very concisely, very cautiously. If it is used, it will help us a lot. So I may say that it is not the conclusion. I want to request our beloved practitioners of homeopathy that to think as a beginning of integrated treatment approach, so that we can treat very easily the obstacles which are faced in different systems of in our limitations. And thank you all for giving me the permission to speak out over here. Thank you.
Partha, over to you.
So, from personal side, it was a very nice experience to listen. Ritam, Dr. Ritam Maity happens to be our junior, and we spend a very good time in NIH. So, it was a fantastic experience to listen you, and at the same time, it was very fantastic to listen your clinical experiences too. Because I personally feel that this is a time when the integrated and interpathy assimilation, coordination should be there to provide relief to the cases. Because time has progressed so much, and we are facing a lot of problems regarding over medications, regarding several other complications of life, many interfering factors, the food, the lifestyle, and there really, as you are very nicely pointed out, you have seen a case where it is not getting cured by homeopathy, and you are applying acupuncture therapy over there. And meanwhile, at the same time, you are sharing a case where the person is having acupuncture, but you are not getting probably expected result. And then you are prescribing homeopathic drugs for the same case. So this is now required because as far as acupuncture is concerned, so it was started 10,000 years back. So it is coming under the traditional Chinese medicine therapy. And the theory of, and a very nice integration you make between the concept of homeopathy, that is vital force you rightly pointed out, with the chi, the positive and negative force, what we call yin and yang. And you very rightly pointed out the juxtaposition of the life. Because so much I have studied, the concept of chi came from the lightened side and dark side of a mountain. So the old Chinese philosophers, Shen Nong, probably the first who wrote the Chinese annal, the first person who experimented drug on himself. It was not Hahnemann only that he had taken China and proved. It is goes the credit to Chen Nong also, who had taken the drug and it was poisonous, and it is said his stomach was burst and the person was died. Anyway, the theory of Confucius, the theory of these two polar opposites and driving a positive energy or reducing out a negative energy are the same point. And in all Chinese medicine, they have even thought, somewhere I read, that the tree, the part outside or over the ground, they are causing the positive energy, and the roots and the rhizomes, so they carry a negative energy. So balancing between this yin and yang is health, and imbalance is a disease. And what you pointed out, that the Pancha Mahabhutas theories, this is somehow different of with of our Ayurvedic system probably. So far, I remember metal and wood came in their theory, what is typically absent in Pancha Mahabhuta theories of the Indians. But anyway, the presentation made by Dr. Ritam, I personally learned a lot of things from him. And if I get a chance, then again I will be personally talk to Ritam to know something better, something more deeper in this study. So now it is the time to call Dr. Birodh Mahato, and he will be talking regarding the levels and layers of health. So the audience is anxiously waiting for his deliberation. So without wasting time, I would like to call Dr. Birodh and to talk in the next hours. Thank you, Birodh. Thank you. Please welcome on the NIH platform.
Good evening, everybody. My name is Dr. Birodh Kumar Mahato, 19 batch BHMS NIH. I'm the Vice President of All Nepal Homeopathic Association, Kathmandu, Nepal. First of all, I'd like to thank the NIH Alumni Association for providing me this prestigious platform to speak on this particular topic. I'd like to thank Dr. D.N. Kalyani, sir, President, NIH Alumni Association. I'd like to thank Dr. Bidyut Mukherjee, sir, and Dr. Chandrasekhar, sir, for insisting me to speak on this particular topic. Well, it was during my first BHMS, we had an international seminar. We had a lot of eminent speakers from all over the world, and one of the speakers was Professor Dr. George Witholkas. He could not attend the seminar physically, but he gave a message, a video conference message on that seminar. And from that day onwards, I was very much keen to learn from him. It was during my internship days, I got a small book named as The Essence of Materia Medica by Professor George Witholkas. When I read the book, I was very much surprised by the way the medicines, the remedies were explained. The essence of remedies were explained quite beautifully. And from there onwards, hunger for learning the teachings of Professor became more and more. It was during 2016 when I got admitted to the e-learning course, a 2-year e-learning course that is offered by the International Academy of Classical Homeopathy, Greece, where I got to learn the teachings of Professor Witholkas. And during that time, I got to learn the theory of levels of health. Now, before that, I'd like to share my screen here. Yes, is my screen visible? Is my screen visible?
Sir, your screen is visible, but your slide is not visible till now. Means it's visible for me
Oh,
over here that I can see, but due to privacy purpose, I'm not bringing it up on screen.
okay, I'm
Just turn
trying.
on your
Is this
slide, then
visible
I
now?
will. Yes, sir. Please
Is
turn
the
on the
slide visible
slideshow.
now? Yeah, is it visible now?
Yes, sir. Please turn on the slideshow.
Slideshow. Okay.
Slideshow, sir. Sir. Sir, please click on the hide button right beside the stop
Okay.
sharing part.
Yes, hide button. Okay. Here we are into the
Yes, sir. What
slides.
do you?
It's slow actually. Yeah. The levels of health theory. It is a theory given by Professor George Witholkas. Professor says the levels of health contains the insight he has gathered during the past 49 years concerning the relation between the chronic and acute diseases and their impact upon the defense mechanism. Now, this idea of level of health, this came out of a lot of questions that were running into the minds of Professor George Witholkas. While practicing, he could see amazing results in some cases, but he could also see failures in some cases. So, what made the difference between these failures and successes? Eventually, from the observations and experience, he found that there are several levels of health, but he did not know actually how many levels were there. Now, before moving into the in the particular topic, levels of health, we'd like to make you clear about some terms. These terms are energy complex, defense mechanism, and symptoms as homeopathic approach. Now, energy complex should always be understood as the overall possibility of organism to react to the stimuli. The stimuli be either internal stimuli or external stimuli, whether is it a positive stimuli or a negative stimuli. Now, whether the treatment will be successful or not. Now, this will depend on two basic factors. The first one is the skill of homeopathic practitioner, how skillful he is. The more skillful, the more the result will be successful. And the second condition upon which the treatment efficacy will be dependent is the good or bad condition of energy complex and the relevant condition of defense mechanism. Now see, the stronger is the defense mechanism, the clearer is the pattern of symptoms. Means if the defense mechanism is stronger, the symptoms presented by the patient will be clearly pointing out to the simillimum. Now, what is defense mechanism actually? Now, defense mechanism is a complex, and this complex consists of the immune system, the reticular endothelial system, the sympathetic system, the hormonal system, and the lymphatic system. Now, when the healthy organism has enough energy to keep balance and maintain the internal order, then the physiological process and defense mechanism, they work harmoniously. Now see, there is a homeostasis, there is a stability, a balance in the organism. Now once the organism comes under stress, there is loss of energy, there is loss of homeostasis, and if this loss of homeostasis is not corrected, death may ultimately occur. Now this defense mechanism is normally continuously active in the background in order to maintain health. Now if this order is not maintained, then the organism will start to produce visible symptoms in order to protect the internal vital parts of the organism. For example, once the organism is exposed to cold, the internal thermostat in the body will develop heat. And if the stressors overcome, the body will develop the symptoms of common cold. Now, if these symptoms that is developed by the defense mechanism, if these symptoms are suppressed, however, we then directly obstruct the action of defense mechanism and force the disturbance to go deeper into the organism. Now, symptoms and homeopathic approach. One thing we need to know is symptoms are not our enemies. They are our allies. Now, these symptoms are the reactions produced by the defense mechanism, and it is the best possible way at that particular point of time by which the defense mechanism will protect the organism. Now, in homeopathy, these symptoms are quite important for us in the treatment. And the substances, the drugs we use are tested upon human beings, healthy human beings. And we discover the symptoms that is produced by the substance on the organism. Now, by comparing these proving symptoms to the symptoms produced by the defense mechanism in a disease process, we discover the most similar homeopathic remedy which can stimulate the patient defense mechanism. This is the similia similis curaventur, as said by Hahnemann. Now we move on to the levels of health topic. Now each organism, whether in a healthy state or unhealthy state, each organism functions on a certain level of health. And at present, we do not know exactly how many different labels are there. Professor George has divided the labels into 4 different groups. And under each group, there is 3 subdivisions. Under group A, we have level 1, level 2, and level 3. Under group B, we have level 4, level 5, and level 6. Under group C, we have level 7, level 8, and level 9. And similarly, in group D, we have 11, 10, level 11 and level 12. Now see, the level 1 people, group A level 1 people, they are the people with the highest level of health. And the lower part, group D people, level 12, they are the people with lowest level of health. I don't know what's going on. Yes. Yeah. For the sake of practicality, it has been divided into 4 groups: Group A, Group B, Group C, and Group D. And further, these labels are subdivided into 12 different labels. At the top of the scale, we find the organism with good general condition and well-functioning defense mechanism. Now, labels of health is characterized by several parameters, and one of the parameter is condition of acute infection. In certain levels of health, we have some sub-infections, while in some levels, we don't have those infections. So what makes the difference? So by observation, it has been concluded that under level 1 of health, we have very healthy individual. These individuals have excellent health, and these people seldom gets acute diseases, particularly acute disease with high fever. These level 1 people, the healthiest people, they seldom get acute diseases with high fever. If they do get acute disease, that would be once in a 10 year. Under level 2, these people, they get few infections in 10 year, and those infections are with very high fever. Under level 3, what's going on with the slides? Under level 3, these people, they have acute infections with high fever every 2 to 3 years. Under level 4, in this level, they have infections with high fever once in a year with common bacteria and microbes. Under level 5, they have 2 to 3 infections with high fever with more virulent organisms in comparison to the above levels. In level 6, they have frequent acute infections with high fever, especially hospital infections and pseudomonas. Now these levels 1 to level 6, they are supposed to have quite good immune system, which can raise high fever with the attack of microbes, viruses, and fungi. Now, high fever is considered as very good response of quite good immune system. Now, this idea was never understood by the medicine, and as a result of this, they used antipyretics to control fever. And as of this type of treatment, we have the creation of further 6 levels of health. Now, after a person has reached the point where least provocation from virus, bacteria, and microbes, there is a fever, and they have acutes every month. Further, after some time, they stop having acutes. And once they stop having acutes, This should be considered as the turning point, because once this acute stops coming, then definitely we have an individual which develop one or other chronic disease depending upon the hereditary predisposition. So once the acute stops coming, then we have the starting point of the chronic disease. And what type of chronic disease the organism will develop, that will depend on the hereditary predisposition of the patient. But definitely once there is cessation of acutes, then there is some inflammatory process going on. Eventually, he will develop some severe condition. Now, once the chronic develop, we have further levels of health. Level 7, there is a chronic condition. We have sporadic acutes, but the fever is not very high. We have mild fever as the immune system is weak. Under level 8 health, we seldom get mild acutes, but only chronic condition. Under level 9, there is no acutes at all. From level 10 to 12, under group D, these are the lowest level. Here in this level, we do not have acutes, but we may have fever, high fever. And that fever is a desperate effort to react. And there is no way in this condition, under high fever, there would be recovery. Strange but true. Ask a patient, when was the last time he had the acutes? Then you have the time from which the chronic disease started. Means once the acute stopped coming, then that was the point where the chronic disease has the commencement. Now it is important for homeopathic practitioner to understand that any pathological condition may arise at any level, but the prognosis will be different according to which level of health the patient belongs. Now see, for example, cancer. We can have cancer patient from level 1, the healthiest people, to level 12, the most difficult cases. Now see, if we have a cancer in a patient with level 1, 2, 3, in these cases, the case is curable quite easily. But as we move down to the chart, we go to the bottom of the table, it becomes more and more difficult to cure. Suppose the cancer arises in a person with level 10, 11, 12. Now these cancer people is quite incurable. Now one thing we need to understand is, suppose a person is in a particular level of health. Now that person may fluctuate in the same level. For example, in our daily lives, our energy and sense of well-being differs from day to day and even from hour to hour. So we all have good days and less good days. Same way in the organism, constantly dynamic state, there is not steady or fixed state, but fluctuation within the same level of health. For example, if a person wakes up in the morning, he's refreshed and he's feeling quite well, we assume that he's functioning on the uppermost part of his level. Now see, we have a chart here. The individual is on level 4. He wakes up quite refreshed. Then throughout the day, he overexerts himself. And as a result of overexertion, he develops cold or pneumonia with high fever. Now what he does is, he goes to the suppressive measure. He uses heavy antibiotics for this. The very next day, he wakes up unrefreshed. And now the previous he was functioning on the highest part of level 4. Now due to the suppressive treatment, he now works on the lowest part of level 4. Now he further has the suppressive treatment. He goes downward to level 5. His predisposition to get cold gets more and more worse. He gets cold quite frequently. He may develop bronchitis and pneumonia. Then there is further suppressive treatment with antibiotics. He goes to level 6. What happens here is the underlying predisposition becomes activated, and the tendency to develop chronic disease like asthmatic condition becomes eminent. Now he has frequent bronchitis. Now once he goes further down, acutes with high fever will stop appearing. Now if this is controlled with minimum doses of bronchodilators, then he may stay on the same level. But if he has a great deal of stress, both emotionally and physically, if he has cortisons all the time, his level will drop further. You'll move on to level 7. You won't have acutes with high fever anymore. Further, under suppressive treatment, asthma will disappear, but he will have a state of extreme exhaustion with depression and total indifference. And in this way, under suppressive mode of treatment, he will drop down further into the levels, level 8, 9, and further down. Now, if this patient is treated correctly, he will go through the same stages in reverse order. And at the same time, he will be climbing in levels of health with aforementioned modalities. Now see, if a person is, say for example, in level 7 or level 8, and he does not develop acutes under correct type of treatment, say under correct type of homeopathy, the health will improve. He will move up to the level, say level 6. There will be asthma, but he will have acutes with high fever. Further, if he has correct type of treatment, then the further level of health will be increased. He may develop rhinitis, moving on to the uppermost level 1, 2, and 3. Now, what happens in different levels after we give the correct remedy? Now, this one is important for the prognosis of the case. See, suppose we have given a patient a correct homeopathic medicine. So, what happens after the correct homeopathic medicine? See, on level 1, these people are healthy peoples. And after the correct medicine, we do not have any aggravation under level health 1. Under level 2, after the remedy, there may be mild aggravation, but fast amelioration as well. Under level 3, the aggravation increases, but within first few hours or days, the amelioration soon comes after. Under level 4, after the correct medicine, aggravation is quite strong, and amelioration is equally impressive. Under level 5, what happens after the correct remedy is there may be aggravation, but it will come after few days, and that aggravation will last 1 to 2 weeks, and amelioration will soon follow. But soon after, the relapse is possible. Under level 6, aggravation comes after few days, may last few weeks, followed by amelioration. But this amelioration won't last long enough, and relapse is certain. Now, during the first 6 months of treatment, we have a lot of relapse. Under level 7, see these people, level 7 people, they do not have acutes with high fever. But after the correct homeopathic medicine, aggravation usually appear with appearance of acute condition and high fever after the correct remedy. Now, in these cases, the remedy needs further repetition and more remedies in specific order to cure the case. Under level 8 of health, severe aggravation comes after the second correct remedy, and they may have acute, which needs to be treated and can be life-threatening but manageable with homeopathy. Under level 9, aggravation comes after few remedies, but never with the first remedy. Under level 10, 11, and 12, no aggravation, only temporary amelioration. And these level 10, 11, and 12, they need frequent change of remedy, usually every 1 or 2 days. Now, prognosis and life expectancy. See, yes. Now, group A people, they are the healthiest people. Under group A, level 1, these people have the highest life expectancy, that is up to 90 years. In level 2, the life expectancy is up to 80 years. Similarly, in level 3, the life expectancy is up to 75 years. In group D, level 4, the life expectancy is up to 70 years. Level 5, 65 years. Level 6, 60 years. In group C, level 7, the life expectancy is up to 55 years. Level 8, 50 years. Similarly, level 9, 40 years. And the group D people, those who are the least healthy people, level 10, they have life expectancy up to 30 years. Level 11, life expectancy up to 10 years. And level 12, the lowest life expectancy, not more than 5 years. Now, what is important for the practitioner is to realize that an individual can be born in any of these levels, 12 levels. Now, this depends on the hereditary predisposition, and that the life expectancy potentially reduces as you go down this scale. For example, a baby born with serious disease like epidermolysis bullosa or thalassemia major will be considered to be born in the lowest level of health. Now, these babies' life expectancy is predicted to be less than 10 years. Now, when we treat such cases, we should bear in mind that we cannot expect to raise the patient overall state of health to such an extent that they will live up to 70 years or more. Now, correct type of homeopathy can uplift the level and thus more the age. A person born in level 4 with a life expectancy up to 70 years can go up to level 3. But someone who is born with life expectancy of 5 years can be treated to live up to 20 years or 30 years. But he will not go up to the highest levels as we cannot overcome his genetic predisposition. Now, susceptibility. Though it is not well known that susceptibility to a certain bacteria, microbes, or viruses, etc., depends on the condition of defense mechanism at a given time, it has also been observed that lower we go down the scale of levels of health, the more virulent and more resistant the microorganisms become. Now, see, under level 1 to 3, we have less virulent microorganisms like Staphylococcus and Streptococcus infection. Similarly, gonococcus infection and syphilis. The influenza virus, viruses and bacteria for epidemic diseases, these all affect the people with level 1 to level 3. Now, as we go down to the scale, from level 4 to 6, we have more virulent organism in comparison to the level 1 to 3, and these organisms are most likely to be Proteus, Pseudomonas, and gram-negative bacteria. As we go down from level 7 to 11, here we have all the degenerative chronic diseases. The compromised immune system of those organisms is not able to react to infective agents affecting in level 2 to 6 with high fever. So under these 7 to 11, as the immune system is compromised, we do not get infections that produces high fever. Now level 11 and 12, in the end stage of disease, as in level 12, and as a last effort of the organism to survive, we again have appearance of fevers up to 38.5 degree with infective agents like nosocomial infections and pneumocystic carinii that could not cure by any medical intervention. Now, in the higher levels of health, we have seen that the manifestations of acute disease with bacteria like streptococcus and staphylococcus that are easily eliminated with antibiotics, making the symptoms subside quickly. That means the higher level of health, the less virulent is the organism, and more easily the symptoms will subside. But if this is treated aggressively and consequently suppressed, the general health will drop and another type of bacteria will manifest that will be more virulent than streptococcus and staphylococcus. And if the immune system is further compromised, we will be infected by the more virulent microorganisms like Proteus, Pseudomonas, and Pneumocystis carinii. Now it is a strange but interesting phenomenon that if an individual system is compromised and his level of health has gone down the scale so that he can no longer raise a high fever, even if he is exposed to certain infectious agents like microbes, viruses, or bacteria. However, once if he is treated correctly so that his level of health improves and his level elevates to at least level 6, he will once again become susceptible to those microorganisms and start raising high fever again. An individual who has severe mental illness, for example, schizophrenia, autism, or any deep psychotic condition, and who belongs to the lowest level of health, will be protected from the infections with different microbial, bacterial, or virus agent simply because his mental health microbes or viruses are unable to affect people who are suffering from a severe chronic degenerative disease, whether the disease is mental or any other type. Now, patient with severe endogenous depression, malignant hypertension, liver cirrhosis, collagen disease, neuromuscular disease, with Alzheimer's disease, EDOC, etc., usually in very high percentage will not be able to raise a high fever enough though, even though they have not had a fever for many years. Actually, since their chronic condition was established. These people, they develop only low type of fever, the fever that is less than 38.5 degree. Now, it is interesting to observe that if mentally ill patient do not get an inflammatory state and raise high fever, such an inflammatory state will be very serious and dangerous for the patient if they get an inflammatory state. But then during this time of high fever, their mind becomes much more clear. Now, these are the observations that will be familiar to doctors and workers who have worked in the psychiatric clinics. Now, in some psychiatric cases, microbes have been used as therapy. For example, tuberculous bacillus has been injected in cases of schizophrenia. Another observation that may seem contrary to the general observation is that the defense mechanism people in group D, level 10 to 12, at the time of appearing death, seems to make a final effort to recover, and during this time they may have high fever, they may have inflammatory condition with high fever, and this is just before the death. Now, when using the level of health concept, we will change the expression miasmatic predisposition into an expression that is more accepted in today's world, medical terminology, that is genetic predisposition. Now, the miasmatic predisposition, the theory of miasm, was given by Samuel Hahnemann over 2 centuries ago. In the first level, we'll recognize perhaps one miasm, and one remedy will be sufficient enough to bring the organism back to health. Now, in the first level of health, there is only one miasm, and one remedy is enough to cure the patient. The symptoms in these patients is quite clear, which points out clear remedy. The remedy pattern is clear because of clear-cut symptomatology. For example, at the age of 60, a person may get a lumbago or common cold or pneumonia or even cancer. And for all these different pathologies, one remedy will act. For example, calcium carb. And this is the constitutional remedy of the patient. Now, this is only applied to the patient with first level of health. And all his condition can be cured with one and only remedy, and that is the constitutional remedy of the patient. Now, with second level, the genetic predisposition is heavier, and more than one remedy is required to cure the case. Similarly, in level 3, the genetic predisposition becomes worse, and we need 3 different remedies in sequence to cure the case. Similarly, in level 5, the predisposition is more worse. About 3 to 6 remedies needed in order to cure the patient. In level 9, many more remedies may be needed to cure the patient. In the lowest level, there is a constant change of remedy. So the remedy needs to be changed every day or every other day. It should be clear that the amount of remedy mentioned according to the levels, these are merely indicative and not fixed. These treatments are highly individual and vary according to the every individual case. Now, importance and meaning of clear remedy pattern. Patient with higher levels of health will have a well-functioning defense mechanism and will probably present a clear remedy pattern to the practitioner. So, as the patient goes down in the levels of health, the defense mechanism becomes weaker and weaker, and remedy pattern becomes more and more hazy and obscure. In the lowest level, there is total confusion. And because of this confusion, it becomes very much difficult to find the remedy that is indicated in the case. We'll have a picture of lot of remedy, and the most similar remedy becomes difficult to be chosen. Now, the general rule will be, lower the patient is on the scale of level of health, the more difficult it will be to find the correct remedy and the correct sequence of remedy. And also more remedies will be needed to regenerate the organism. The higher the level of health, the clearer would be the remedy pattern, and we need fewer remedy to cure the patient. The concept of constitutional remedy only belongs to the level 1 of the levels of health. Now, regarding potency selection, under group A, level 1 to 3, we can use from the very lower potency up to the CM potency. Similarly, in group B, level 4 to 6, initial potency from lowest potency to 10 m for the level 4. For level 5 to 6, initial potency up to 1 m. Similarly, in group C, level 9, the potency that can be used is initial potency up to 200. And under the group D, the lowest levels, group 10 to 12, level 10 to 12, the initial potency should not be more than 30 C. The potency selection, however, depends on the combination of factors, of which the first one is sensitivity of the patient. If the patient is sensitive, who proves every remedy, we should not give him higher potency than 30. 30 is the highest potency. The next is, the higher the level of health, the higher is the initial potency of the patient. Now, the next one is, deeper the pathology, the lower the initial potency. And the last one is the health of patient. If the health of patient is in imminent danger, suppose he has a severe heart problem, it is better to start a treatment with the low potency. And the more is the similarity of the medicine with the case, the higher is the potency. Once again, thanks a lot.
Now
Thanks a
over
lot.
to Partha sir.
So this was a fantastic session. So that was taken by Dr. Birodh. Vitulkas is a living legend, as we have learned from our early college days once. And the incidents Birodh just mentioned. So this was a all India seminar most probably. So there we had got some extra online some words that came from Dr. Vitulkas. And Vitulkas is the describer, modern describer of homeopathy, because he explained mathematica in modern terms. Because he explained, if you study his mathematica, the essence of homeopathic mathematica, as just Birodh mentioned, and the talks of classical homeopathy, the 3-volume books. The first case with phosphorus, it is no one can forget if one had studied. This was the first attempt that was taken by Dr. Kent. Because for Hahnemann, due to unknown reason, the potential was restricted to 30 C. But he had used 67th and this. The whole book of organon and in chronic diseases. We'll see the potency selection that was done by Dr. Hahnemann. Later, when this legacy of homeopathy had gone to the hand of the USA or United States or American homeopaths, so there we have seen a foundation of making potency higher. So higher everywhere. Dazen has got a very fantastic book, Practice of Principle and Practice of Homeopathy, that Ari Dazen, who translated the 5th edition. The letters are very small, but the book is fantastic. So there we will get these American homeopaths, they raise the potency higher to higher. If we study the Kent's clinical cases, we'll see 44 aim, 46 aim, because they were in the process of fixing the potencies. 100 potency will get, what is not available now in market. Because if you see in the potency scale, there is a big gap, 30, then directly to 200. Then it is to 1M, then it is to 10M. Then it is to 50M, CM, DM, MM potencies. Rarely we will find, it is not available in most of the medicine manufacturers. So this is the preambling of the topic. The growth of homeopathy was rested on the shoulder of American homeopaths at the beginning of the 19th century almost. Where get the legendary homeopaths in America. One side there is Kent, another side there is Boger, another side we will see Clark, another side we will be seeing this Allen, Carol Dunham, Richard Hughes. So during that time, Kent was the first person who tried to tabulate homeopathy in a better scientific way. The method of second prescription, how it could be. The first hint was given by Bonning-Ocean, we all know. But that was not accepted too much. Even in our practice also, we do not follow, but still the method was very scientific. Kent was the first person who said about the prognosis of a case. And that he had written in a lecture was delivered, and that lecture is placed in his philosophy of what we call Kent's philosophy. It was a lecture actually. So there he had made a way of how to make a prognosis of a case. So that is almost a story made in 100 years, because Kent's philosophy was published in the year 1900, 1900. So now we are living in the years of 2022. Means this book was written 122 years back. Terminologies were changed, concepts changed. So Vithalkas again had tried to amalgamate in his level of health all the ideas in a single platform. This is fantastic to see. The initial categorization of A, B, C, D, 4 groups. Every 4 groups has got another 3 categories. And over he is speaking about the dynamic diseases. Gradually, how it is getting descended. We are getting the multimasmatic, irreversible pathological. Upper level, we are seeing the psoric diseases. Gradually, how much it is getting down, we are getting more schizosyphilitic tubercular phases. And the rule is not getting changed. We have to observe. We have to agree to this point. There at the top level, we are getting again, because of functional disease, as Birodh said just now, because of the functional state, the potencies are high. And gradually, when it is getting down, the potency is likely to be low. So it is a very nice work made by this living legend of homeopathy. And it was the demand of the time what was felt by this person. The science of homeopathy undergoing several changes and additions. If we keep a look on the additions made, initially he had tried to find the doctrine of causality, how the cause is going to the effect. The cause is linear, non-linear. He's mentioning the Kalyani photography. Now he had jumped to this fantastic amalgamation of the function to structure and telling miasm with the potencies. So it was a fantastic work made by Vithalkas, and I would like to congratulate and thank Dr. Birodh that he really brought a very essential part of homeopathic teaching, because initially the teaching should be there and then it will be applied in the practice. So this man had done a lot of practices, 40 years, not a joke. And from that he constructed this idea. So I would like to thank again Birodh to bring this topic in the cognizance of the listeners of this very esteemed platform of NIH Alumni Association. And I would like to thank again Dr. Kalyani sir, Dr. Bidyut Mukherjee and Dr. Chandrasekhar Puri, and who are really conducting this work. And obviously my dear Orko, who is tirelessly working on this platform since the very first day of this lecture. So thank you once again, and I would like to hand over this charge on the respective persons. Thank you so much.
Thank you very much, Dr. Partha, Dr. Birodh Kumar, and Dr. Ritam Maity. Sir, we think we are really proud of our alumnus. Individually, everyone is
Definitely.
performing so nice, and on diverse topics, everyone is trying to give their full, wholehearted inputs. Sir Orko, I'll request you, as I cannot operate the studio fully. Do we have any questions? Or, sir, we have two winners of the quiz competition tonight. I'll request Orko to bring them on screen one by one, and they can ask the question to their relevant speakers of their choice. Welcome, Medico Sandeep. You are from Midnapur College. Can you put on the camera? Hi, Sandeep. To
Good evening,
whom
sir.
you want to ask the question?
Good evening, sir. The session was very much informative and amazing and undoubtedly very informative. But please, Dr. Ritam sir, if you describe the process of anyone the acupuncture process therapy by any video by virtually, then it will be more clear to us.
Will you please repeat your question?
Sir, any video virtually the clear processing of the any acupuncture therapy?
Do you
How
want to
to,
see the video of acupuncture treatment?
no, sir, just the processing, how to apply over the patient.
Should I demonstrate on this camera now?
Partha?
Yes, sir.
Yes.
If you and Kalyani sir permit, Ritam will put a demo.
No question of that. Get a permission from Kalyani sir.
Sure, sure.
Kalyani sir?
Definitely.
Sure. A
Definitely.
small video. Yeah.
Small video
Okay.
is a
Yes, a
brief
small
time.
video of procedure. Yes.
Okay, Ritam, go ahead.
Should I demonstrate now how to perform acupuncture?
I think he's asking for in brief, because it's a lengthy
I couldn't
process.
understand actually what he's telling.
Have you got any prepared video, Ritam?
I have with my needles and other things. I can prick on myself only. I cannot perform it into other. I can do
Exactly.
acupuncture on my body itself.
That he has
If
already
you
shown us.
allow me to
That you have
perform this
already
thing,
done.
I can do very easily.
That you have already shown us.
That you have
We have
shown.
Yes,
seen it.
maybe
Yeah.
the
My
question.
humble suggestion is,
Exactly.
My humble suggestion is, Dr. Sandeep, I will request Dr. Ritam
Yes, sir. Yes,
that he
sir.
will make a video spool, and he will upload to this Telegram group. So there we can see actually what Dr.
That's
Ritam
a
is
good,
doing.
very good, very good, very
So
good idea.
I will request
Yes,
Dr.
sir. It
Ritam
is
to
good
make a
message
small
you
video
are.
spool of 2 to 3 minutes where you are actually performing the work on your patient, and please upload it into the Telegram group. And I would request Orko that you please to send the link to Dr. Sandeep.
Great. It will be done, sir.
Thank you, sir.
Welcome, Shoaib. Shoaib, if you can turn on your camera. Your question to which speaker, Shoaib? Unmute yourself, please. Shoaib, can you hear us? I think there is a network problem with Shoaib. Orko, is there any question on the live chat tonight?
No, there is none. There is no questions. Could we wait? If any viewer can ask a question. just give them some time to ask a question.
Okay,
Shoaib
we
Ahmed
are
is back. I know Shoaib Ahmed is back. Let him ask a
okay.
question right now.
Bring Shoaib on camera. Please bear with us for the network delays. It's not in everybody's hand, but we like to thank the network service providers, whoever it is. At least through this
Just bear with
phase
us.
we are going through, which are having a connectivity issue, but still we had been able to connect with each other. And we are happy to announce that till now we have almost 110 live viewers, uh, which has been recorded in our studio. I had been giving that information to our moderator tonight. 123 live viewers till now through our studio. Shoaib is back.
Fantastic.
And in between, so long Shoaib is back, I'd like to request all the viewers and the alumnus across the globe. Already, why I'm saying across the globe, because tonight we have Birodh, who is from Nepal. We had alumni in Bangladesh, in Sri Lanka. They have a homeopathic NIH Homeopathic Alumni Association in Sri Lanka. Like we have alumni in Germany, in Russia, in Canada, in USA, and various probably in Poland. So NIH Alumni Association and the alumni of NIH is now present across the globe, and we are trying to connect through this internet to all the alumni across the globe. And we like to. This appel is normally done by our beloved Pralay sir, but Pralay is a bit busy with other works, with his official works. Otherwise, you'd have joined by now. Now, it's a humble appeal to all the alumni and the well-wishers of NIH to donate for the benevolent fund. The benevolent fund has been created during the pandemic to help the alumnus in need in difficult times, in challenging times. And so far, we had been able to contribute to few of the alumnus who had left us during the pandemic stage, and few alumni who had suffered, but by grace of God is now back to normal life. So it's a humble request to all the well-wishers and the alumni of NIH to donate generously in the NIH Alumni Benevolent Fund. The account number of Punjab National Bank is given in the description, as well as Orko is showing it in the screen. Orko is showing it in the screen. And moreover, we are trying to get the membership done also. The membership is very nominal, 100 rupees per month, per year. And we have started the bank account way back in 2010. So whoever had passed before 2010 can count for the membership fees from 2010 to 2022. So for me, like first batch of BHMS, for me, if I'm paying it now, it will be 1200 rupees as membership fees up to 2022. And whatever the amount of benevolent fund, anything above rupees 1 can be contributed for the benevolent fund. And thank you. Over to Kalyani sir. And if Shoaib is there, Orko, for his question. Orko, is Shoaib there?
No. Over to Kalyani, sir.
Many thanks to every one of you who are viewers, especially our inaugurator, today's inaugurator, Dr. Debabrata Mahapatra, for very nice inaugurating the CME. Excellent moderation by Professor Partha Pratim Roy, a beloved brother. All along he's assisting us in every respect. And very nice, brilliant speech from both of us alumni, Ritam Maity, Dr. Ritam Maity and Dr. Birodh Kumar Mahato. Really, today's CME is a gift to all of us. I think all of you must agree. Because of my responsibility to add a little bit that I want to add with two speakers on two subjects and to the viewers. That you see, brothers and sisters, this integrated system of treatment is bound to come in the world. Because all system of medicine, including Hahnemann, including homeopathy, wants health as it is termed, it is said in Organon, means in all respect, every one of us wants perfect, proper health in the society. First reason, if our system does not receive other system, means if our system do not develop the integrated system of medicine, patients or peoples automatically they will find out the integrated system of medicine by which he will be fit in normal physiological state. I think all of it, you will be agree with me that even Hahnemann was very, very fond of integrated system of medicine. I will give you the example. See, it was our master Hahnemann who told that there is some pseudo-surgical diseases. What does it implement? That there are definitely some true surgical diseases for which homeopathy should refer the cases, should not take the responsibility with the life. It was Master our Hahnemann who proposed that there is a system of mesmerism. Without medication, without any globules or alcohol, they are at a system of treatment by simply rubbing from a distance by palms on the seriously suffering patient to give improvement. So during his time, just imagine, decades, your centuries before, he had the concept that all the diseases cannot be cured by homeopathy. As he told, iatrogenic hazards should be avoided. There are serious iatrogenic hazards in allopathic system of medicine. He told many things, but at the same time, he agreed and supported and introduced few other system of treatment. That was about Hahnemann. I will tell you another history. You might have all heard the name of Dr. Doctor of Sri Ramakrishna Dev, Mahendralal Sarkar, Dr. Mahendralal Sarkar. He was the president of IMA. In one All India seminar, he told, as a in his presidential speech, that there are some unscientific system of medicine in India which should be abolished, which should be stopped by making rules from the government to assist the peoples to be harassed by unscientific system of medicine. That means he was informed of abolishing or destroying homeopathy, Ayurveda, and this and that system of medicine in one annual conference of Indian Medical Association as president. He came back to Kolkata and eventually he was presented by one of our legend homeopaths of Kolkata, dozen organons of medicine. Dozen organon, Dr. Mahendralal Sarkar studied seriously for 7 times. Just imagine how many of us have studied dozens of organons 7 times, I do not know. 7 times to realize, to feel what type of treatment it is. In the next year, in his presidential speech, he told Dr. Sarkar that last year I was very sorry that last year I was proposing to destroy certain unscientific system of medicine like homeopathy. But I have realized that there are many such type of system like homeopathy which needs to improve for the proper health of the peoples. Immediately all the doctors started shouting as it happens normally. Then he told, I know, please be quiet. I know what I have to do now. He put out his resignation, not only as president, but also as member of the Indian Medical Association. He presented his resignation on spot. And he told, I am leaving this conventional allopathic system of medicine and joining homeopathy. From then onwards, he started homeopathic practice. That means Mahendralal Sarkar, who was founder of Cultivation of Science-like institution, he was fond of integrated system of medicine. I will tell you my one experience. When I was called for interview for getting service in NIH, first time I was called and I was interviewed, and I asked to wait outside. Chairman told, I will call you later, please wait, don't go. So I was waiting for a long, after full completion, after 5 p.m., I was again called for the second time before the board. And I was asked, which post do you want, teaching or research? There was 2 posts. And I applied for both, RA and JMO. By this time, I was very much tired of teaching, because a very lengthy and tedious experience of teaching of different subjects in Birodh Homeopathic Medical College. And I realized that teaching is definitely good, but something should be done for homeopathic system of medicine, which only teachings cannot do it. So I proposed that I want research. Then he asked, why? You are a good orator, why you are asking for research? Then I told, sir, homeopathy is yet to be improved, and any system, any science cannot improve without research work. Then he asked, what type of research do you want to do? Then I told, the unknown things. People are getting improvement, but science is not looking after that. I want to work on those sides only. Then he, by joke, chairman was one madam, doctor. He told, see, there are many types of treatment. Madhuli, Tabiz. Do you want to research on them? They are also not scientifically proved. Then I strongly told her, yes, madam, I am fond of doing those researches too, because people are living thousands and thousands years in villages, rural areas, depending on those medicines, which science has never bothered. He was very much encouraged, very much pleased, and he told, yes, you will get the research post. Thank you very much for your ideas. Then chairman told, there are many things in everywhere which are yet to be revealed scientifically before rejecting. Thank you very much. You carry on your work. What I want to tell you, integrated system of medicine does not mean to become jack of all trades. Integrated system of medicine means what our doctor said, that we must know our limitation and scope. That is very, very important. Like all other systems, homeopathy has got its specific limitation and specific scope. Wherever we are crossing our limitation, wherever we find the patient are beyond our limits, immediately refer the cases to appropriate system of medicine. That we call referral system of medicine. You'll be astonished to know, very recently, in one OPD card of SSKM Medical College, that I am having the document. In first advice, allopathic doctor from SSKM Hospital Emergency Department is writing, continue homeopathic medicine, not home medicine, homeopathic medicine, first advice. Second, third, fourth, modern medicine, allopathic medicines. That means every system is now ready to accept with honor, with respect to any system. Simply, we have to improve ourselves. We have to know our scope and limitation. Accordingly, we should refer the cases for the health of others. Regarding the very beautiful speech of Dr. Birodh Kumar Mahato, many, many thanks. A very new thing to many of us. Works of Dr. Vidal Kaus. I think you might be knowing his life history. He was a man of struggle. To me, homeopathy is a system of struggle. Starting from Hahnemann till date, the people who are struggling with strain and traces, they are becoming good homeopaths. Not only by studying, not only by curing patients, in every regard. Those who are not satisfied by what they are already having, they are the real homeopaths, means creators. You see Hahnemann, he had to change his views, improve his views, fifth, sixth time, editions of organon. Kent, Herring, they were not satisfied by Hahnemann's contribution. Bonning Hossain, they strived with the patient's situation, condition, studied homeopathy in details. They started thinking, struggled a lot, and introduced many brilliant gems of philosophy, principles of homeopathy to improve homeopathy system of medicine. Recently, for a few decades, what we found that innovative thoughts are very lacking in all over world on homeopathy. In this regard, Dr. Vidalkaus, Professor Dr. George Vidalkaus is a really gem to the present era of homeopathic system of medicine. He has shown the struggle and the dissatisfaction with what we are already having, because dissatisfaction makes an end of development. Science cannot progress if we are satisfied. So this dissatisfaction, what we are having already, Professor Vidalkaus was not satisfied. He started thinking, brooding, and finding out other improvement or a further improvement of homeopathic system of medicine. So many thanks to all the speakers for highlighting beautiful, brilliant things for our acceptance. Thank you very much. Many thanks. Again, I should appeal to all of you, please come forward with other subjects what you have experienced, and encourage other your friends, senior, juniors to join with the CME to share his experiences to improve all of us. Thank you very much.
Thank you, sir. And with that, we conclude tonight's session. We are returning back to our backstage editor, Orko, and all the speakers and persons in the studio, please stay back for post CME studio discussion. Over to you, Orko.
Thank you all. Thanks for watching. If you have liked this video, please give it a like, share with your fellow batchmates and also with your fellow homeopaths. And do let them know that we do CMEs every second and fourth week of every month. So do subscribe us to get updated and go join our channel in Telegram. Over there, we update previous events very fastly. We update over there, and also like us on Facebook, follow us on Instagram and Twitter. We also update there of our next upcoming CMEs and etc. We also give the registration link so that you can be a winner too, be in the lucky draw by answering few questions. And if you get all of them correct, then you will get a chance to be in the lucky draw. And as far I see, Sandeep Chakravarti and Shoaib have the luck to come in every aspect. What are the great odds? So with this, good night and heading over to the post CME talks. Until then, bye bye. See you in our next CME.